Hey guys, my name is Jay and you are watching Medical TubeMade. So today I am going to talk about MDM part. MDM is very important key components of evaluation and management. Everyone knows. So MDM having three important tables. So here you can see number of management option and diagnosis. This is the table 1. This is table A. Okay. So another one, amount of complexity of data review. This is table B. And then level of risk, this is table C. So while counting in MDM, medical decision making in evaluation and management, there are total 3 tables, and on the basis of these 3 tables we have to decide MDM level. And MDM is very important key components of evaluation and management. So guys, this is table A. Table A means diagnostics and management option table, sometimes called as problem table also. Why? Because we have to think about problems here. So these are the problems. So this is problem column, then number column, and then points, and then final results. See here, self-limited or minor problems. So I will explain one by one. So here, self-limited or minor problem, that means suppose as per your report came for any self-limited problem, so you can take 1 point. Self-limited problem means insect bite, cold condition you can consider self-limited or minor problem. So here you can see 0 to 2. 2 means maximum 2 points you can take. Suppose 2 conditions means you can take 2 points, maximum 2. Then establish problem. Establish problem, stable or improving. Suppose patient came for the problem and this problem is already established problem, means in that time you can take 1 point. Then third one is established problem worsening. If the patient came for established problem and this problem is now worsening, so in that sense you can take 2 points. Suppose for example patient came for diabetes mellitus and this diabetes mellitus is a established problem, and now it is uncontrolled or worsening, so that time you can take 2 points. Why? Because established problem worsening. Then third one is new problem with no additional workup plan. So patient came for new problem for the physician, and for that problem doctor has not planned any workup like lab order, any injection or radiology order. So these are the workup things. Okay, so patient came for new problem with no additional workup, means you can take 3 point. Here you can see 0 to 1. 0 to 1 means you can take maximum 1 only. Then new problem with additional workup. So new problem with additional workup means you can take 4 point. For example, patient came for head injury, and head injury, for that condition physician has order, maybe physician may order CT head, ultrasound, X-ray, any lab order, any injection given, means all intervention, all type of intervention you can consider workup. Okay, so new problem with additional workup means you can take 4 point. So this is the table A, and here one more table is there. Okay, so here you can see these are the points and these are the table A final. Here suppose as per your report the patient came for head injury and this is the new problem, and for that problem physician has ordered CT head. So new problem with additional workup. So new problem with workup means 4 points. So 4 means your table A is extensive. That's it only, table A. So like that guys, you can understand it very well. Then I'll give one scenario. In that scenario you can understand well again. In this scenario you can see here diagnosis, acute cystitis. Patient came for acute cystitis, and for that condition doctor has prescribed drug and then order lab also. So urine, you can see urine analysis, WBC, RBC, means this is the lab order. So for that condition doctor has order lab. So suppose this is new problem, a new problem with workup. See, new problem, cystitis is a new problem and additional workup means lab is the additional workup. So you can see here in this table, new problem with additional workup, you can take 4 points. 4 point means, here you can see 4 point means your table A is extensive. That's it, only table A. So guys, this is table B, amount or complexity of data review, means it's a data point. So this is the data, and these are the points. Okay, so here the first one is clinical laboratory test. Any lab review or order, so we can consider 1 point. Then radiology, so any radiology order or reviewed, we can take 1 point. In bracket here given, except cardiac cath or echo. So this is the exception of cardiac cath or echo. Why? Because these two condition count in medical test, means we should count in medicine test. Okay, so radiology order or review 1 point. Then medical test means medicine test, for example PFT, ECG, cath, echo. So these are the medicine test, means if the physician order or reviewed medicine test, means you can take 1 point. Then next, discuss test with performing physician. You know, performing physician is different and ordering physician is different. Suppose any test discussion is given with performing physician, means you can take 1 point. Then independent review of image tracing or specimen, we can take 2 points. Independent review means separately reviewed should be there properly. And then next point, discussion to obtain old record. Suppose for that patient, physician need to obtain old record for a well understanding of that patient. So for that scene, physician will order old record. If they mention physician order old record, means in that sense you can take 1 point. And then last point is reviewed and summarize old record. If doctor has mentioned properly, they have reviewed or summarized old information or old record, and it should be mentioned in your report properly, that time you can take 2 points. So like that guys, you have to count point in table B. So these are the data points. So here one more table is there, you can see, and in that table here these are the points. Okay, suppose as per your report you got 3 points. Suppose 3 points means your table B or your data table will be moderate. So if you got only 1 point, suppose only lab order, so 1 point means minimal, 2 points means limited, 3 points means moderate, 4 or more means it's a extensive. So like that we have to count. I will give one scenario, in that you can count and you can understand better. So this is the scenario. Here you can see diagnosis: patient having acute cystitis or hematuria. Hematuria is nothing but the symptom of acute cystitis. So we have to count data points here. See, this is cystitis, and for that condition physician has order, we have to count. See here diagnostic testing they have given. See, urinalysis, RBC, WBC results are given. So that means patient physician has order a lab. So that means 1 point confirm. And then read completely, and then you can see here order ultrasound and pelvic. So ultrasound pelvic is a radiology part. So you got 1 more point, and nothing is there. As per me, there are only 2 points. See, one is lab test and the second one is the radiology. So as per your report, as per your scenario, you got 2 points. So 2 point means your table B, and amount complexity of data reviewed 2 means your table B is limited. So understood? So like that only we have to count points, and after that in that table you have to check whether table B is minimal, limited, moderate or extensive. So it's very easy. So guys, this is table C. Table C means risk table. Okay, so here you can see level of risk: minimal, low, moderate, high. So high means it's a high risk condition, okay, highest level, and minimal means it's lowest level. So I will start from minimal. So here you can see one self-limited or minor problem. Self-limited or minor problem means cold, insect bite, tinea corpus. This type of condition comes under in self-limited. Okay, so here one self-limited condition: lab test, venipuncture, chest X-ray, EKG, EEG, UA, ultrasound. For example, echo, KOH preparation. In management, you can see rest, gargles, elastic bandage, superficial dressing. These all are comes under in minimal risk. Okay, then guys, check for low risk. So here you can see 2 or more self-limited or minor problem. In case of minimal, 1 limited minor problem, but in case of low, 2 or more limited minor problem should be there. Then 1 stable chronic illness and acute uncomplicated illness or injury. 1 stable chronic means suppose the diabetes mellitus, hypertension, hyperlipidemia, like that. And then here physiologic test not under in stress, non-cardiovascular imaging, superficial needle biopsy. See, superficial, not deep. Okay, OTC drug. OTC means over the counter drug. For that drug no need physician prescription. Then minor surgery, no risk factor. Then PTOT, physiotherapy or occupational therapy, and IV fluids with no additives, means no drugs. So these all conditions comes under in low risk. Okay, then guys, check for moderate risk. For moderate, you can see here 1 or more chronic illness with mild exacerbation. See, in case of low, chronic illness stable. In case of moderate, mild exacerbation should be there. Okay, 1 or more. And then 2 or more stable chronic illness. If in your report 2 chronic illness and both are stable, means we can consider moderate. If suppose 1 stable chronic illness, means you should not consider moderate, then it will goes to the low. So like that guys, here 1 or more chronic illness with mild exacerbation for moderate, and 2 or more stable chronic illness should be there. In case of diagnostic, physiologic test under stress, diagnostic endoscopy, deep needle biopsy. In case of low, superficial needle biopsy. In case of moderate, deep needle biopsy. And in management section, you can see minor surgery with risk factor. In case of low, no risk factor. In case of moderate, minor surgery with risk factor. And then elective major surgery. Okay, the surgery itself having major risk. Okay, then RX drugs management and IV fluid with additives. See, RX and in prescribed drug. RX drug means it's a prescription drugs. And in case of low, OTC drug, over the counter drug. And in case of moderate, prescription drug should be there. And next point is IV fluid with additives. Additives means additional drug. In saline, in NaCl, suppose they have added diclofenac, so that time we can consider moderate. So like that guys, we have to check this condition for moderate level. Then guys, check for high risk condition. So high risk means it's having life threatening condition. Okay, so life threatening condition such as ACS, acute coronary syndrome, myocardial infarction, heart failure, kidney failure, respiratory failure, stroke, severe brain hemorrhage. So these types of condition means these are the life threatening condition. All condition comes under in high risk. Okay, and here you can see 1 or more chronic illness with severe exacerbation. So it should be severity should be more. And then acute or chronic illness with threat to life. Okay, so it should be a life-threatening condition. So cardiovascular imaging, cardiac EP study, diagnostics, endoscopy with risk factor, discography. And here you can see elective major surgery with risk factor. Okay, major surgery with risk factor, emergency major surgery, and then parental control RX. So this all comes under in high risk condition. So I will give one scenario where you can understand well. So diabetes mellitus is a chronic condition. So check in your level of risk. See here one point, they have given 1 stable chronic illness. So diabetes mellitus is a chronic condition and now it is stable also. So our chances of level of risk should be low. Why? Because it's not a minimal condition. So directly check for low. So after that we have to check, it's a confirm to low, but we have to check again carefully document for any, is there anything for level moderate. Okay, so after checking you can find here microbid 100 mg is order for the patient, means it's a prescribed drug. So here you can see RX drug management, so that means RX drugs management means prescribed drug given, so our level goes to the moderate, from low to moderate. Why? Because of prescription, and because of diabetes mellitus level goes to low, but because after checking prescription you have to assign moderate. So as per this scenario, for that scenario our MDM risk should be moderate. So guys, this is final MDM table. Here you can see final MDM level. Okay, so final MDM level means here you can see straightforward, low, moderate or high. High means it's the highest level, straightforward is the lowest level. So we have to decide final MDM level on the basis of these three tables. So that I have already explained, table A, table B and table C. So on the basis of these three tables we have to decide final MDM level, and for that we have 2 out of 3 criteria. For example, here you can see for straightforward 1 point in diagnosis table, means 1 point from table A, 1 point from table B and risk minimal. So it's a straightforward. For low, 2 to low. Then moderate, 3 points in A table, 3 points in B table and moderate risk in C table. And then for high risk, 4 points in table A, 4 points in table B and risk table high. So like that guys, on the basis of these three tables we have to decide. So here I will show you one example, means result. Suppose your table A having 4 points, table A having 4 points, table B having 2 points and table C having moderate risk. As per this example we got this result. Okay, so table A extensive 4 point, table B limited 2 points and table C moderate, risk is moderate. So final MDM we have to check from highest to low. So check for high risk. For high risk we have table A is supporting for high risk, but table B and C is not supporting for high risk. So at least 2 should be there, 2 tables should be support. So 2 tables should be in support. Why? Because here 2 out of 3 criteria is there. Okay, 2 out of 3, but here only 1 is supporting. So go one step back and check for moderate. Okay, so for moderate risk is supporting. Okay, so risk table is already supporting for moderate, and table B is not supporting for moderate, and table C supporting for high. That means it's supporting, we can check, we can take for moderate also, because it's having 4 points and for multiple required only 3 points. So we can take table A for multiple also. So we can take this is also, because it's having 4 points, means it comes under in 3 points also, it's a multiple we can take. So 2 out of 3 means 1 risk and another one is table A. So our final MDM should be moderate. As per this scenario our final MDM should be moderate, because these 2 tables are supporting for moderate. So like that guys, we have to identify final MDM. I will give one more example to understand well. So here as per this example, table A having 2 points. See, table A having 2 points and table B having 3 points and table C low. So here no chances for high, check for moderate. For moderate only 1 table is supporting. Okay, but we need at least 2 table. Okay, so go back again. So check for low. Okay, for low we have risk table also supporting and table A also supporting. So 2 out of 3 criteria is matching here. So we can take final MDM as a low. So like that guys, our final MDM is low. So this is only the final MDM. We have to decide on the basis of these three tables. So guys, you should be learn these three tables very well: table A, table B, and table C. This is only our today's topic, MDM. So please like, share, and subscribe Medical TubeMade.